Hi, my name is Sharon Coronado and this is Dan, my patient, and today we're going to cover an exam on musculoskeletal and the neurological systems. I'm going to start first with the musculoskeletal and we'll start with the jaw. So Dan, I'm going to just have you, I'm going to put my hand right on your tragus area and I'm going to be palpating your temporomandibular joint, and what I want you to do is just open and close your jaw, and I want you to kind of go side to side with your jaw. And then retract and forward with the jaw. Okay, so when I feel his jaw, I can feel some clicking and popping. And that's some crepitus in the joint. So next we're going to move to your neck. And with your neck, I'm going to start by having the range of motion. I'm going to have you turn your head to the side and back the other way, a rotation. And then I'm going to have you flex your chin down to your chest and then back. And then look up at the ceiling. That's extension. Okay, good range of motion. And now I'm going to have you test your muscle strength of your neck. I want you to push against my hand on your face. Okay, and this way too. Push against that way. Good. Now push against my hand on your forehead. Okay, and back behind your head, push against my hand. Good. +5 on the muscle strength. And now I'm going to move to the shoulders. First, I'm going to just palpate Dan's shoulder and make sure there's no tenderness at the head of the humerus, the acromion, or the choroid process. Any tenderness when I do that?
No.
Okay, perfect. So with your arm, I'm going to first start by having you lift your arm all the way up, 90-degree angle. Okay, good. And then down, all the way behind you. Okay, flex and extension, perfect. And then I'm going to have you go out to the side with your arm. That's adduction, and then forward in front of you, cross, cross, cross in front of you. That's adduction, great. And now I'm going to have you use your arm and go behind your back like you're scratching your back with your arm. That's internal rotation, and then bring your arm up behind your neck sort of. Perfect. That's an external rotation. So he's got full range of motion. So I'm going to have you put your arm right out in front of you and try to push down on my arm. Push, 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 push. And then above, push against my arm. Okay, great. +5 on your muscle strength. And then I'm going to look at his elbow. And with his elbow, any tenderness when I palpate your arm?
No.
Okay. So now what I'm going to have you do is flex your arm up like you're making a muscle. Okay, good flexion, and then extend it out straight. Okay, great. And then this position you're in right now is supination, and I'm going to have you turn your arm like that. It's pronation. Great. So now I'm going to have you pull against my arm like you're making a muscle and try to stop me. Pull up on your arm. Pull, pull, pull. Good. And then push against my arm. Okay, great. +5 on the muscle strength. And then we're going to go to his wrist. And I'm going to look at his wrist just to make sure. And his fingers, he's got all 5 fingers. I don't see any bumps or any nodules or deformities. And I'm going to have you turn your arm over. And what I'm going to do is I'm going to just tap on your wrist here, okay? Does that hurt when I do that?
No.
Okay, that's a negative Tinel sign. And that's just a check to see if you have carpal tunnel syndrome. And another thing that we can do too is with your thumb, just to pull against my thumb. Does that hurt when I do that?
No.
Okay, great. So last thing I want to check for the carpal tunnel is I want to put your hands in like a reverse church position and see if that hurts your wrists at all, any numbness.
No.
Okay, that's for a negative Phelan sign. And then when I look at your fingers, they're good, and what I want to have you do is like spread your fingers out. That's adduction, and bring them together, abduction. And then can you kind of go like this with your fingers? Okay, great. All right, perfect. And what I'm going to have you do lastly is test the strength. Can you squeeze my fingers? Okay, good strength. And then I'm going to have you make a fist and pull your fist up. Okay, great. And then push against my hand. Okay, great. Okay, thanks. Examine the spine, but first I just wanted to mention that all the tests that we do on the right, we also do equally on the left. But I'm going to start by looking at his spine, make sure his shoulders are equal, And I'm going to have you just flex forward like you're touching your toes. And I'm just going to examine his spine, any tenderness when I palpate down your spine. And I'll check his iliac crest, make sure his back is equal. Okay, you can come back up. And what I'm going to have you do is first arch back. This is hyperextension. And then I'm going to have you kind of go side to side with your arms all the way over with your back. And then on the other side all the way over with your back. Okay, good. Now I want you to twist back and forth. Okay, great. Okay, that's good. So I would say that's +5. Well, I would just say the range of motion is good. Next we're going to go to the hips, and I'll just have you lie down over there. Okay, and for the hips I'm going to start by having you raise your leg all the way up. Okay, that's a good flex, and then down, extension, and then bring your knee up. Just bring your knee up, perfect to your chest, and then down. Okay, and then I'm going to bring your knee up and see if you can rotate it inward rotation, and then we're going to flex it out like a little chicken wing. Okay, good. And now let me just use your leg here for a second. We're going to go adduction out and abduction in. Okay, you can rest it down. Actually push against my hand. Okay, and then pull up against my hand. Okay, great. +5 on the muscle strength there. Next we're going to examine his knee. Any pain or tenderness in your knee there?
No.
I don't feel any swelling or anything. And flex your knee up like you're going to kick a ball, and then down. Flex and extend. Okay, great. And then I'm going to have you push against my hand again. Okay, and then down. All right, and then we're going to move down to your ankle and your foot. Okay, we just feel any tenderness or pain there when I press?
No.
Okay, and what I'm going to have you do is flex your foot down. That's dorsal flexion, and this is plantar, up like that. Any discomfort?
No.
Okay, so push against my hand.
Okay.
And then push against my hand this way. Excellent. Okay. +5 on that for your muscle strength. Now continuing on with our neurological exam, I'm going to look at Dan first and see he's alert and verbal and he's responsive appropriate. And on the Glasgow scale he'd be a 15. And everything that we test, we're going to also test equally on the other side. We're going to start first with the cranial nerves, and the first cranial nerve is the olfactory nerve. So I'm going to start by having you occlude one of your nostrils and close your eyes and breathe in and out. Can you breathe through your nose okay?
Yes.
Okay, then I'm going to give you a smell to see if you can smell it and identify it.
I can.
And what is it?
Smells like cloves.
Okay, good. That means your cranial nerve 1 is intact. Now we're going to move to cranial nerve 2, which is your optic nerve. And for that we would do the Snellen distance chart. We would do the small print test just to check your visual acuity. We'd also do the fields of vision. And I'm going to just shine a little light into your eye over here from the side.
Sure.
And I'm going to see that your pupil dilates good. And when I do that, your other one also accommodates. The equal in size and shape. So your eyes are equal, accommodating, and consensual in size and shape. So then we're going to move on to cranial nerve 3, 5, and 6 together, which are for extraocular movement. And I'm going to just have you follow my pen with your eyes and not your head. Go this way, up, down, over, and then up and down. Good, I don't see any nystagmus of any extraocular movements. So then we're going to also test number 5, which is the trigeminal nerve, and with that I'm going to just check your facial. So when you clench your teeth for me. I want to just feel that your masseter muscle is good and strong, and your temporal muscle when you clench your teeth. I can feel that too, so that's nice and strong. And then I'm going to do a test to see sharp and dull. So first I'm going to just show you what sharp is on your hand. That's the sharp side, and this is the dull side. And I'm going to just do that with your eyes closed on your face. You can tell me if that's sharp.
Yes.
Which is it, sharp or dull?
Sharp.
Okay. And then, sorry. And then we're going to just test up here on your forehead, dull or sharp?
Dull.
Okay, and then we would also do the same on the other side. So he could identify that appropriately. And then we're going to move down to cranial nerve 7, which is your facial. So I'm looking at Dan's face. And smile for me. Equal smile. Everything looks symmetrical on his face. And can you puff out your cheeks? I know, that's good. And how about close your eyes? Can you close your eyes tight, 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 and open them? Okay, good. That's good muscle movement there. And the next cranial nerve is cranial nerve 8, which is the acoustic nerve. And for that test, we would test with the Wren, the Weber, and for air versus bone conduction, and the whisper test to check for that. Next, we move on to cranial nerve 9 and 10, which is the glossal pharyngeal. And for this one, I'm just going to have you say, ah. And I'm just looking up at your soft palate, and it looks good. Everything's movable. And I would also check his gag reflex for that as well. And then moving on to the spinal accessory nerve, which is 11. I'm going to just push against your shoulder and push against my hand. Okay, good. Now push against my hand with your face. I'm checking your neck strength. And with that, push against that way. Okay, great. +5 on your muscle strength. And then lastly, we're going to do cranial nerve number 12, which is the hyperglossal. And back to the tongue. Can you just stick your tongue out for me? Out straight, your tongue out. Perfect. Nice and symmetrical with your tongue. No deviations. Okay, now we're going to test the reflexes. I'm going to start first with the biceps reflex. I'm going to hit here. And good number 2 with that. Now, okay, relax your arm with your elbow hanging. And I'm going to hit here. And that's a good triceps reflex, a +2 on that. Then I'm going to hold your arm here, and I'm going to tap here. Okay, good +2, that is the radiobrachialis. And then I'm going to move down to the patella, where I'm going to just relax your leg if you can. I'm going to just hit here. Okay, good. +2 on that. And then I'm going to go down further, and I'm going to dorsiflex your heel up. And I'm going to tap your Achilles. Okay, and then I would also go on the outside of his foot and get the Babinski reflex after that. And that's all. Testing the motor skills. Dan already showed me he walks appropriately, normal gait. And now we're going to do heel to toe, walk across the floor, heel to toe, good balance. Okay, you can stop. And then I want you to put your feet together, arms by your side, and close your eyes, see if you drift. Okay, no drifting, little drifting, that's normal. And then continue with your feet together, put your arms up, palms forward, and close your eyes again and see if you drift at all. Just a little bit, which is normal. Okay, that's a negative pronator sign. See if you can lift your foot up and stand on one foot. Okay, great, good balance. And see then if you can bring your foot up and run your foot down your shin. All the way down. Okay, thanks, excellent. This is our last motor test, and what I'm going to have you do is put your arm out to the side, and I'm going to have you touch your finger to your nose and then to my finger with the eyes open, and then do it again with the eyes closed. Finger to nose and then to my finger. Perfect. All right, and with your eyes still closed, I'm going to just have you flip your palm of your hand over, and I want to see if you can identify that object in your hand.
That's a battery.
Okay, good. That's a test for diagnosis, and then I'm going to draw a number on the palm of your hand with your eyes closed.
3.
Good, and that's a test for graphesthesia. That just is a good sensory test. And then I'm going to use my tuning fork with your eyes closed. I want to see if you can identify this vibration and tell me when it stops.
Stop.
Okay, and I'm going to do the same on your toe with your eyes closed, vibration, and tell me when it stops.
Stop.
Okay, perfect. And then last, I have one more test of proprioception, and I'm going to just have you be able to tell me if there's 2 points or 1 point with your eyes closed. If you feel 2 points, this is 2 points, and this is 1 point. So just tell me when you feel 2 points.
2 points.
Okay.
1 point.
Okay.
2 points.
Okay, great. Excellent.